purpose today to really show you that it is possible to prevent and heal the widespread mental health and psychosocial problems we're already facing for all sorts of different reasons, and those speeding our way due to the climate emergency. Just a very brief overview of who we are, what we're doing, and what I'm going to talk about. We started the ITRC almost 10 years ago, 2013. And it's been growing ever since. I used to direct the Climate Leadership Initiative at the University of Oregon. We were one of the very first climate change research and technical assistance programs. We worked all over the country, helping local governments, state governments develop their first climate action plans. And it was when we saw Superstorm Sandy hit the East Coast, that's when we realized that the mental health issues were going to be significant. I'm trained as a counseling psychologist, as David said, and in environmental science. And when we saw Superstorm Sandy, we saw all the mental health problems skyrocket. Other people in the climate field didn't see it because they're not trained in that. They're engineers, et cetera. And that's when we knew this was a problem. So we've been running conferences and workshops for many, many years. And then about 4 years ago, a number of our members, we have Red Cross members, the Psychosocial Center in Denmark, and many others, came to us and said, we got to come up with a different way to address these issues. We cannot keep up with the disasters and other issues we're seeing around the world. So we launched a project that we thought was going to be a 6-month project. Research project ended up being 2.5 years. We looked and talked with people all over the world. Has anybody got an approach or methods to prevent and heal widespread mental health and psychosocial problems generated by ongoing adversities? And it turns out we do know how to do that. And that's what I want to talk to you about today. And that is to use a public health approach to mental wellness and resilience, not the individual clinical approach we really dominates in the US. And with that information in mind, for 3 years, we've been facilitating a community of practice on this. We also realized that we needed new policies to support a public health approach to mental health. That led to us to get the landmark bipartisan Community Mental Wellness and Resilience Act introduced in Congress. We're actually having a virtual congressional briefing on it next week. And as we were doing this research, a lot of people said, is there any manual for how to organize these community-based public health approaches? So that led to a book that I published that came out in March, Preventing and Healing Climate Trauma as a Guide to Building Resilience and Hope in Communities. So let me start with the bad news that you all likely understand, but we need to just touch on, and that is our challenge is that we're actually in the midst of a climate ecosystem biodiversity catastrophe. And I'm using the word catastrophe specifically because it comes out of the disaster sociology field. In that field, emergencies are defined as short-term events that are usually caused by single factors that have limited geographic and social or physical consequences, and they don't last long. Disasters have a longer time frame, a larger impact, but are still characterized as single events that end and give people time to recover. But catastrophes are very different. They are defined as events that have multiple interacting impacts that are very substantial and widespread, that build on themselves, are cumulative, and often have unforeseen, surprising, long-term consequences. And consequently, catastrophes are often much more complicated, severe, and prolonged than emergencies and disasters, and give people less and less or no time to recover. And most importantly, is that you don't respond to or manage a catastrophe in the same way you respond to and manage emergencies and disasters, because they're more complicated, severe, widespread, cumulative, and prolonged. And we are in the midst. The climate catastrophe is what we're experiencing. It's not about just disasters and emergencies. We're in the midst of a catastrophe situation, yet we've been mostly using long-standing approach like disaster mental health, individual clinical treatments that were set up for something very, very different than what we're experiencing and will increasingly experience. So that's important to remember. And also that it's an ecosystem, biodiversity, and climate crisis. It's not just about emissions in the air, in the atmosphere. It is about the breakdown of ecosystems and habitats and the loss of biodiversity that is all combining. And this combines to make it a public health emergency. And this requires that we think and respond through a population lens, and I'll explain this, not merely reacting to symptoms of pathology or the next crisis and disaster one at a time, which is pretty much all we're doing. So just very quickly, even though disasters capture our attention, the next wildfire, smoke event, flood, as they're having in the Northeast now, et cetera, the most pervasive impacts that we see from our members all around the world and in the US growing are actually the cascading disruptions to the ecological, social, and economic systems people rely on for food, water, shelter, income, health, and other basic needs that are stressing everyone. Often you can't connect climate change to some of these rising food prices, food shortages, et cetera, but they're there and they stress everyone, and they are often activated by or combined with the more frequent and extreme emergencies and disasters that can traumatize millions of people. And so it's the combination of this with especially this cascading disruptions. We have I work in Africa with some groups, and they're seeing these cascading disruptions much more than the disasters, food shortages, water shortages, that require forced migration for people living other places, et cetera, et cetera. And that kind of stuff is coming here, folks. I hate to say it. Everyone is going to be impacted consequently as the climate emergency accelerates, and it's going to do that very, very quickly. This is a population level problem. But in the near term, in different ways, times, and magnitudes, there are some populations, some groups that are at greater risk, and we know who they are: BIPOC residents, low-income residents. You can see the list. And because of this, climate change is clearly aggravating existing inequalities and injustices and adding a whole bunch of new ones that directly affect many of these populations and groups. So everyone, all sectors of society have really got to grasp that. And if we leave this unaddressed, the result is going to be a global epidemic of distresses and traumas. What do I mean by that? And I'm just going to do this quickly. What do we mean by emotional, psychological, and spiritual distresses? It's an understandable or normal response associated with stressors or demands that are difficult to cope with, or the result from witnessing others in harmful situations or fantasizing about future impacts. Many of us, this is what climate anxiety is about, is this kind of distress. But we also see widespread individual traumas, and this can be defined as a blow to the psyche that breaks through one's defenses with such brutal force that we can't respond to it effectively. And it so often happens in catastrophes. People withdraw into themselves. They feel numb, afraid, vulnerable, and very alone. This is Kai Erickson's definition. But we are also experiencing community traumas, which are not as well understood as the individual and the traumas and distresses. And I live in south of Eugene. And 2 years ago, not far from me, the entire town of Blue River burned down. Blue River, that's a community trauma. It's a series of an event that creates a blow to the basic tissue of social life that damages the bonds attaching people together and impairs their sense of community. It's the gradual realization that the community doesn't exist anymore as an effective source of support. And then consequently, an important part of ourselves has disappeared. Community trauma can apply to a specific geographic area, but also people with shared identities, such as religious or spiritual or refugee or internet groups. And we're also seeing with the climate emergency what we call societal traumas, which goes beyond a specific geographic area or a group with a shared identity to affect entire cultures, nations, or all of humanity. The COVID-19 pandemic is a classic societal trauma. It affects everybody. And if we leave these issues unaddressed, the climate catastrophe is going to prove to be the greatest societal trauma modern humanity has ever seen. In addition to that, and many of you in this field really know this, that uh, illnesses and diseases dominate climate health. But in fact, according, it's an old saying by Brock Chisholm, the first director of the World Health Organization, there is no physical health without mental health. Comorbidity is very common, but often unacknowledged in both fields, the physical health and the mental health field. Adverse mental health conditions aggravate or directly produce physical health problems, and physical health problems often aggravate or produce mental health issues, but they're typically siloed in the different fields, and we fail to recognize them. And pervasive traumas can feed on themselves and become epidemic. And that's because unaddressed trauma becomes buried in our nervous systems, in our limbic systems. And can cause people to deny what's happening, dissociate, blame others, attack others, self-sabotage by trying to self-medicate, for example, using drugs and alcohol, and that ends up harming us and harming others. Or we reenact the same pattern. We try to work it out somehow, and we end up following the same patterns that cause the problems in the first place. And is seen time and again throughout history. These kinds of individual, community, and societal traumas can combine and interact to unravel families, groups, communities, and entire societies. And we are seeing that now. It's not all driven by the climate emergency. It's driven by a lot of other factors, but the climate emergency is part of it and is caused by part of these issues. And just as importantly, the activation of the emotional brain, the limbic system, by the stresses and traumas people experience, cause them to retreat into a self-protective survival mode. This is natural. It causes people to become more conservative. We don't want change. We don't want anything because we're just trying to protect ourselves. And that is driving much of the opposition to climate policies. In our work, we talk to people all the time in the field, on the ground, who oppose increased prices or changes in greenhouse gases or fossil fuel use, et cetera, not because of any particular political or ideological view. It's a reaction to things gone wrong in their lives. It's an instinctual reaction. I can't take any more. I can't pay more. I can't change this, et cetera. Climate traumas and many other mental health and psychosocial problems we're experiencing today are caused not just by individual genetic or family issues, they're there, but by individual, family, social, economic, physical, and ecological factors. This is the social ecological model. This is really what we need to focus on. All of these interacting factors, the mental health field is typically focused just on the individual and their families, which is real, but it's not sufficient. Doesn't address this. And mental health and social services will remain important as we try to address these issues, but they can't address today's level of traumas. And there's no chance that this approach alone can help prevent or heal the scale or scope of the traumas speeding our way. There's not nearly enough clinicians to help everybody. They're located mostly in wealthy or urban areas. And there's many other reasons that this approach alone won't work. So we've got to get out of our silos and together think systemically and respond holistically. But we have seen in the work we do that if we take this path, the climate catastrophe can activate what we call deep-seated transformational changes. And you just talked about, what do you mean by resilience? Well, here's our definition. We have to build population level capacity for transformational resilience. And that means when suffering is caused by previously unseen external forces that have no endpoint, no resolution or simple cure, which is exactly what the climate emergency is. The priority has got to be to help people develop the capacity to buffer themselves from and push back against those stressors, and find constructive new sources of meaning, purpose, hope, and courage in life. So another way to say it, the two core focuses of what we call transformational resilience is to help everyone develop the capacity for presencing or self-regulation and co-regulation, to calm their body, mind, emotions, and behaviors in the midst of adversities. Because we're revved up, we go into this fight, flight, freeze reaction when we're activated. But just as importantly, we have to teach everyone. We have to have everyone develop the capacity for purposing, which is adversity-based growth in the psychology world, and that is ways to find new sources of meaning, purpose, hope, and courage. And we have seen in the work we do on the ground that the combination can really rebuild faith and hope in the future, presencing and purposing. And the capacity for transformational resilience is also shaped by those interacting factors described in the social ecological model. We have to address all of them, not just the individual and their family. We have to address community issues, structural issues, and environmental issues. When we were doing our research, we bumped into and came across a quote from the noted clinical psychologist George Albee, who said, "No epidemic has ever been resolved by paying attention to the treatment of the affected individual." That's true in any public health issue, right? And this is a psychologist speaking, not a disease specialist, etc. And that led us to realize that to deal with these population level, multi-systemic traumatic forces that are rising as the climate emergency accelerates, we need a public health approach to mental wellness and transformational resilience. So what does that mean? A public health approach to mental wellness and resilience takes a population level approach, not one that merely focuses on individuals with symptoms of pathology or high-risk groups, quote-unquote vulnerable groups, but they are included in the population-level approach using what's called proportionate universalism and life course approaches. If we had time, I'd go into those. But our mantra has to be, leave no one behind. A public health approach to mental wellness resilience prioritizes preventing mental health and psychosocial problems before they occur, not merely reacting to or treating them after they emerge, which is what our entire system's set up to do now. And it integrates group and community-minded healing methods into the prevention strategies. I'll talk a little bit more about that soon. And so we must always remember that prevention is the cure, not treatment, prevention. And it does that, it accomplishes those two things by engaging residents and strengthening protective factors, social supports, resilience skills, norms, habit, local resources that build and sustain healthy thinking, behaviors, and systems, not just fixing deficits or treating symptoms of pathology. So our emphasis has to be on building strengths and resources, not the flip side of that, which is what pretty much most of our systems do. And the research shows that mental wellness and transformational resilience can be enhanced, and that the best way to do that, the most effective way, is to establish the social infrastructure in communities that can be called resilience coordinating networks. Many of the groups that do this, and I'll share a few of those now soon, they call it something similar, like resilience coordinating task force, a steering committee, etc. But these resilience coordinating networks bring together a broad and diverse array of grassroots and neighborhood leaders, civic groups, nonprofit, private, and public sector leaders to plan and implement multi-systemic, and what I mean by that, they address all those different factors in the social ecological model that are chosen by local folks that are tailored to local needs to strengthen the capacity for mental wellness and transformational resilience among all residents. Here's an ideal resilience coordinating network. This is actually a variation of the New Hanover County, North Carolina Resiliency Task Force. You see they have a steering committee on the inside there, or you could, some groups call it their board of directors. They often name co-chairs, and they might see looking up at the top, there's neighborhood leaders, private sector, civic leaders, youth leaders, public sector, mental health, nonprofit, faith leaders. They're all involved. And then outside of that are a whole bunch of different subgroups, or what we call resilience innovation teams, that are working with different populations or different sectors. There's groups working with neighborhoods, as you see up in the upper right hand, with the private sector, with youth. I'm going down to the right. Education, with the educational systems, the public sector, human services, disaster management. They're working with different populations, different sectors, but they come back, they share their strategies with the team. They get feedback on it. They identify gaps, who's not being served. And they strategize about fundraising strategies together, and it's very, very powerful. I just talking to Tina Pearson, who runs the New Hanover County, North Carolina Resiliency Task Force, and I think she said they have 70 different groups working on this, and they keep them all coordinated in this way. Our research identified 5 foundational areas that are going to be critical to build population level capacity for transformational resilience, for the climate emergency. And I don't have a lot of time to go into this because I want to save time for question and answer, but the first and far away the most important is to build social connections and supports across cultural, economic, and geographic boundaries in the community. These are bonding, bridging, and linking social support networks, if you know that language. And there's some just exciting programs out there doing this kind of work. Edmonton, Canada, their Abundant Community Edmonton has actually gone out and identified and trained block connectors, somebody on every block who goes out and interviews every person living on that in the neighborhood. It finds out what they're interested in, what their needs are, what their concerns are. They put it into a database and they share it with everybody. So people find that, oh, down the block there's somebody who likes to do woodworking like I do, and they get to do woodworking together. Or people find out that, there's 5 people on within the next 3 blocks that like to go walking their dogs at 5:36 in the morning before work, and they meet each other and they start to do that. The San Francisco Neighborhood Empowerment Program, another exciting program, closes down streets in the middle of downtown San Francisco, main streets, and invites all the residents and high rises, et cetera, to come out and have a potluck. They bring out, they share food, everybody gets to know each other. And from that, they organize a resiliency task force that develops a resiliency plan for the local neighborhood. Those are just some examples. The second is to ensure a just transition by actively engaging residents in creating low emission, climate resilient, physical built, economic, and ecological conditions. Somehow we think dealing with the physical environment has nothing to do with mental health and the mental health services and psychosocial well-being, but in fact it's vital, because unhealthy and unsafe and unjust housing and transportation and economies and ecological conditions causes significant mental health problems. But when people get involved and engage and see progress in improving that, it enhances mental health and psychosocial well-being and resilience. We often rely on government or the private sector to engage in this, but there are exciting programs around the country that say, no, residents are going to be critical involved with this. The third component, again, I'm reading these linearly. It's not really this way. Many of these programs start in different places. They start with different ones. They go back and try to address others. But it's to foster universal literacy about mental wellness and resilience. This builds on health literacy, helping everyone understand how trauma and toxic stress can affect their body, mind, and emotions. And the same thing, how it affects groups. That's called becoming trauma informed. And then learning those self-regulation and adversity-based growth skills, presencing and purposing skills. The fourth key area we found was to help residents regularly engage in specific practices that the research clearly shows enhances mental wellness and transformational resilience in the midst of adversity, helping people figure out how to laugh a lot in the midst of ongoing adversities. Practicing forgiveness, keep learning, finding simple joys. There's a neighborhood resilience group up in Victoria, Canada, that felt that people were just really depressed and felt hopeless because of the smoke events they were having, et cetera. And so they went out and they created a program to help people develop theater events that help people laugh. And it was incredibly successful. They put together a manual for how to do it. It's on their website, and they say, everybody, go out and help people learn how to laugh. And in doing that, of course, they're addressing some of these other issues. They're building the social connections across boundaries. They're helping people engage in these kind of activities. And the fifth foundational area that we identified is that We have to also establish age and culturally appropriate, mostly peer-led, group and community-minded healing opportunities. Um, and these are healing circles and others that bring together 5 to 100 people at once. They share the distresses they're having. People find out that, oh, I'm not alone. There's nothing wrong with me. This is perfectly natural. People share how they're dealing with it. They build the social connections. They learn how trauma and toxic stresses are affecting their body, minds, and emotions. All those things happen. So this is going to be critical in all the different communities. It's not just about, so many people will not be traumatized when they engage in those other 4 activities, but many are still going to be traumatized. So it's really important. And you'll notice down in the right-hand corner, clinical treatment, mental health services are still going to be important, but they're just a small part of what's really going to be key. And so we know this can be done. Here's just a few examples of resilience coordinating networks in the US. North Carolina, the Smart Start program, the Healthy and Resilient Communities program has 40 different networks and programs underway across the state, and they're focused on 4 ACEs: adverse childhood, adverse community, adverse climate, and atrocious cultural experiences, meaning racism. Virginia has 32 different networks across the state. They're mostly focused on ACEs, adverse childhood experiences. The Community Resilience Initiative in Walla Walla, Washington is one of the leaders in this, been underway for a long time, and it was started as part of the the Washington State Family, I got the name wrong, Family Resilience Program that's no longer in operation, but it was very successful. One of the very first programs doing this kind of work. The San Francisco Neighbor Empowerment Program, as I mentioned, Peace for Tarpon. There's 200 associated with the MARC, Mobilizing Action for Resilient Communities program, that was assessed by the Health Federation of Philadelphia a number of years back, mostly again focused on ACEs. There's also many examples of community-based approaches to mental health and psychosocial support, as it's called, MHPSS, internationally, and I participate in that. And this is the definition from the International approach, puts individuals, communities, and social systems at the center of the intervention in all phases and of the response. And that's really what is needed. It is that community is medicine. And it's very different than the model that dominates here, where the trained, licensed experts are the people that deal with mental health and psychosocial well-being. Now, in fact, what we now know is if we're going to deal with the issues related to the climate emergency, we have to return the responsibility for enhancing and sustaining wellness and resilience to neighborhoods and communities where it has existed for most of humanity. And we have to really do that. And the mental health and social service programs are going to remain very important in helping with that. Only a few of the initiatives I just listed frame their work as a public health approach, but they're mostly using that. Each is unique, and none address all of the 5 core foundational areas I just described. And only a few, although there are some, that are explicitly focused on the climate emergency. But if these initiatives are strengthened and thousands of new initiatives are launched, we can build university or population level capacity for transformational resilience. So we just have to keep that in mind. And I will say, there's a few of these kind of networks in Oregon, but not many, and we have no systemic program going on. So with all this knowledge in hand, as I said, for the last 3 years, we've been offering a community of practice to people. We've had people from all over the world. We just had a session this morning, 2 hours ago, for people. They're from England, they're from all over the UK, they're from Africa that are involved. And next year, we're going to launch 2 new community practices, one for community members and human service professionals, and one for government personnel. And let us know if you're interested. But as I said, we also realize new policies are needed to fund and support these resilience coordinated networks. So we worked with Representative Paul Tonko from New York to develop what became a bipartisan bill. The landmark Community Mental Wellness and Resilience Act of 2023 was introduced with Representative Brian Fitzpatrick, who's a Republican from Pennsylvania, as well as a Republican from Nebraska, Don Bacon, and Mary Pertola and Kathy Castor. And it was then introduced in the Senate by Senator Ed Markey and our own Jeff Merkley from Oregon and Richard Blumenthal. And it's endorsed now by over 150 organizations, and you can find the list on the ITRC website. And what it will do, it will direct the Center for Disease Control and Prevention to establish a planning grant to help organizations develop a grant proposal and get organized, and then a program grant to support existing community resilience coordinating networks to set aside funding, 20% of the fundings for rural communities. It requires CDC to establish a technical assistance program to help these communities. And the House bill appropriates $30 million for the program, which is not much, but the Senate version appropriates $100 million. So if we get this bill passed, there's probably going to negotiate in between, and it's going to end up somewhere in between. What makes the Community Mental Wellness and Resilience Act of 2023 landmark legislation? For the first time, the federal government's going to fund and support communities that use a public health approach to have residents actually design and implement activities that proactively prevent and heal mental health and psychosocial troubles by building population level mental wellness and resilience. And this is very different from our traditional approach of reacting to crisis or trying to treat mental health problems only after they occur, mostly one at a time. And the different approaches and methods that people are using were not developed just for the climate emergency. They were developed for many other kinds of stresses and traumas. So the benefits of organizing these community-based initiatives are going to go far beyond climate distresses and trauma. One other thing, Senator Ed Markey, I don't know if you know this, introduced a Green New Deal for Health a couple of months ago, and it includes a stronger version under a different title of the Community Mental Wellness and Resilience Act called a Grant Program for Community Wellness and Resilience. And again, it has $100 million in there. So we've got two different vehicles in Congress now. If you haven't and don't know about the Community Mental Wellness and Resilience Act, we invite you to learn about it and endorse it if it's your organization endorsement. I know Oregon Physicians for Social Responsibility has already done that. And please contact your House and Senate members and urge them to pass this. We need similar policies here at the state level in Oregon and in all state levels. I saw somebody from Washington State. Absolutely. We need the similar kind of policies here. And also to help grow the movement, we're going to soon announce what we call a support and commissioning program. The ITRC is going to help organize community resilience building initiatives or functioning RCNs, and then we'll commission them when they've grown to the point where they really are effective, that giving them a stamp of approval that allows them to go out and raise their own money, et cetera, and contact us if that's of interest. And finally, as I said, when I was doing all this work, when we were doing this work, we had a team of grad students doing it with us. People kept asking, is there a manual for how to organize these local resilience coordinating networks? And so this book came out of it, and you're welcome to find this on, it's Routledge, Taylor and Francis, and I think you can get a 20% discount on it if you order it soon. So with that, I'm going to stop and see if there's time now for questions. And David, do you want to just see if you want to, I don't know how you want it. You want to just take them from chat? Or you want to open it up for a dialogue?
Yeah, thank you so much, Bob, for this incredible presentation and all this information. There's definitely a lot to think about, and I think what we can do is if anybody has a question, feel free to use the function on the bottom, the raise hand function, to raise your hand, and I can just take on questions as I see them on the screen, if that's okay. Looks like we do have